thank you for joining us today. You're watching The Doctor is In, and we are here to provide you with virtual care in this time of the coronavirus. I'm Dr. Freddie Gomez. Even if we're under MECQ, it's still back to school for many of our students this August. But with schools closing down and moving into remote learning, we find ourselves working under circumstances that are entirely new to us. Today we'll discuss a topic that delves into the younger members of our population. How does COVID-19 affect our children? And how can we manage their screen time as they return to school this month virtually? Joining us today is Dr. Theresa Arranz-Lim. She's a developmental and behavioral pediatrician. Welcome to the show, Dr. Lim.
Hi, Freddie. Good afternoon. Thank you for having me.
Great to have you. Yes, it's great to have you on the show, Dr. Lim. Kanina nabanggit natin na ilan sa mga eskwelahan ay magbubukas na ngayong buwan through virtual learning. Face-to-face classes are off the table for now to protect children from COVID-19. Dr. Lim, how vulnerable are kids when it comes to catching COVID-19?
Well, in the beginning of this pandemic, we thought medyo hindi sila masyadong vulnerable, no? But we're finding out that many of them may catch it in a very inadvertent way. Medyo asymptomatic lang yung marami sa umpisa, pero now we're catching more kids na parang nagkakaroon ng mga more severe cases. So they are just as vulnerable really as the adults. It's just that siguro mas resilient sila ng kaunti.
That's right. And based on the data, children face minimal risk from that of COVID-19. And almost all of the children have very mild or no symptoms at all. But children are just as likely to get infected as adults, and they can still spread the virus to others. Kaya paalala po namin na walang pinipili ang virus na ito. Lahat ay kailangan mag-ingat. Kaya, Dr. Lim, is there a difference on how the virus affects young people compared to adults and that of the elderly?
Well, as I emphasized, with children, usually they will have mild symptoms, pwedeng fever or walang fever. They can have, the earliest that we noticed were the skin manifestations, no? Pero now, a lot of them may have abdominal pain, may have fever, may have runny nose, so parang flu-like symptoms then. The thing is they're able to bounce back, unlike your high-risk adults na nagkakaroon ng mga complications. But they're still capable of having the same complications. So nakakatakot din kasi they're just as vulnerable actually. And the younger, the more vulnerable they are.
Yep. That's right. So they're just as susceptible to being infected with COVID-19. Now let's answer some questions from our viewers. Our first question is from Odi Evangelista. Do some children get multi-system inflammatory syndrome or MISC after developing COVID-19? What do you think, Dr. Lim?
Yes, that's true. And it's very scary. No? Actually, like I said, earlier in the pandemic, we used to think that the children were less vulnerable and that they would fly through this pandemic. But now we're seeing a lot more children that are getting this symptoms of MISC or the multi-system inflammatory syndrome in children due to COVID-19. And it's really scary because the thing is, it happens usually after they have already had the COVID-19 virus for some time in their system. Usually about maybe within the 4 weeks after they are actually infected. So medyo traidor siya.
Yes, that's something. That's right. That's right. So that's something the parents or those who are viewing this should look out for. So if your child is infected with COVID-19, they are not out of the woods yet. Kailangan pa rin nakatutok po tayo even weeks after mag-resolve na or gumaling sila with COVID-19. Now we have another question from Leia Ocampo. Can babies get infected by COVID-19?
Oh, yes. In fact, because I'm part of a government hospital as well, no, we're seeing some infants that are actually infected with COVID-19 as early as 7 days old. They start manifesting. And of course, it's more devastating among young infants. COVID-19 infections can really take its toll because their immune system is not yet developed. So lalo silang mas vulnerable, so they can really get into really severe symptomatology at that age.
Wala talagang pinipili ang virus na to.
Wala,
May isa pa
wala.
tayong tanong galing kay Mari Mendoza. Ang tanong ni Mari, if children get infected, how do they spread the virus to adults?
It's the same way as adults, no? It's a really droplet infection as we believe it to be, no? And of course, the more you are able to expel the virus through either sneezing, coughing, or even singing and talking, then you can spread it to any particular individual. Ang pinipili nga. So it can spread from an asymptomatic young child or a child to an adult, and before you know it, meron na pareho silang COVID-19.
So paano kaya yung doctor? What can you advise to our viewers who have kids with them or hindi nila pwedeng maiwanan sa bahay, kailangan nilang kasama? What type of precautions should they take? Must children have different precautions from that of an adult or pareho lang sila? The mask wearing, the social distancing, and the hand washing?
Pareho lang. Actually, it's just logical that we avoid it at all costs by using, the usual hygiene measures that we've been trumpeting for the longest time, no? So ang unang-una dyan is facial mask, especially when you go outside. You try to avoid social distancing kasi syempre if there is an opportunity to spread it was from crowding or from close contacts. And then hand washing, the simple hand washing, which seems to be parang akala nila. In fact, hand washing is sometimes more effective than alcohol if you do it properly and you do it for the 2-minute recommendation that they give. So actually the same precautions that we have for adults is the same for children. And of course, if we can avoid bringing them out of the house unless absolutely necessary, and that's the best way. Prevention is better definitely than an ounce of cure.
Very important tips that our viewers should be able to note of. Thank you very much, Dr. Maria Theresa Arranz-Lim, for being with us today. COVID-19 pandemic has affected educational systems worldwide, leading to total closure of schools to help contain the spread of the virus. We'll talk about the distance learning and its pros and cons when we come back. Stay tuned to CNN Philippines. We'll be right back. welcome back to The Doctor Is In. We are very glad to have you. I'm Dr. Freddie Gomez. The government has implemented temporary closure of schools to help contain the spread of the virus. But such closures can have an impact on learners' development. Joining us now is Dr. Annalyn De Guzman Capulong, a psychologist and assistant professor at the UP Department of Psychology. Good to have you on the show, Dr. Capulong.
Good afternoon, Doc Freddie.
Now, Dr. Capulong, parents have been homeschooling their kids or having them take online classes even before the pandemic has started. But because of COVID-19, the school system as a whole is shifting to these methods. How does this affect young students mentally, physically, and more importantly, emotionally?
Okay, so basically, if you look at young children, especially school children, of course, still the best way for them to learn, ideally, is a face-to-face interaction, exploration. No, but of course, given the pandemic, we really have to face the fact that we don't have any choice but to really embrace this distance learning. No? So definitely, children or school children will definitely be affected in terms of really adjusting, because the way that they will learn now, supposedly learn, would be different from the dynamics of the face-to-face interaction. So I think it would be very helpful if parents, caregivers, as well as how the school will prepare, no, their plan and their lesson plan modules to really what they call this guide, no, the school children. So hindi madali po ito dahil kakaibang mode, no, of learning.
Hindi talaga madali ito, and for this to succeed, hindi lang po yung eskwelahan ang kailangan mag-take part, kundi ang mga magulang as well. And one of the issues being raised is that the absence of face-to-face classroom sessions can degrade children's long-term learning prospects since social interaction is limited to family members lang. What are your thoughts, Doctor, about distance learning? What are its pros and cons so that our viewers will have a concrete idea on how this can help their child?
So I guess given the context of pandemic, we really don't have much choice, no, in order to make sure the safety and yung good health of children. Of course, we don't have a choice but to do the distance learning. But of course, that would just be part of the education of children. So there will be a portion that would be distance learning, but let's not forget na kailangan din ng patnubay, no, ng magulang sa online learning na ito. Kasi bukod sa online learning, after this online learning, that could be limited naman, no? It's not all day. So you see also the important part, papel ng magulang, kung paano nila i-extend yung natutunan online into the practical setting in the home. So talagang parental involvement is very important, no? So there has to be a good balance between, of course, learning through online because we don't have much choice given the pandemic, but at the same time, in the confines of the home, parents and caregivers should also be there to really guide the children, no, school children, kung paano gumawa ng homework, kung anong kailangang aralin, no? So there has to be really a routine given to children, no? Because let's remember that children would really get a sense of security by providing routine. So as parents, no, and caregivers and even educators, we could help if we provide structured routine for them.
Yes, I couldn't agree even more with you. Ano? Ang mga bata, lalo na sa age nila, kailangan talaga ng structure, kailangan ng routine, kailangan they should be able to form those habits and discipline. And distance learning provides flexibility for students to work at their own pace and review as needed. However, problems such as having regular access to technology and too much screen time and lack of self-motivation can occur. Now, before we tackle those topics, let's answer some questions sent by our viewers. This question is from Angeline. Ang tanong ni Angeline, ano po ang dapat gawin ng mga magulang every after online class? Dapat ba ay mag-allot kami ng time for face-to-face sessions with our kids? What do you think, Doctor?
Okay, so after online classes, I think it's very important to let the children relax first. Hindi yun, di ba? They just went through online, medyo structured activities from the school and then sabak agad ng face-to-face interaction with the parents. It's important to let the children relax and maybe engage in play because we also give importance to play, no, as part of caring for the children. So after nilang makarelax, even siguro relax, play, and then merienda or whatever, you can just make sure that in your routine or schedule, you allot there a certain portion that you will follow through, no, whatever the children learn online through the face-to-face interaction with the parents. And it doesn't have to be very, very strict, the schedule. No? Make sure that parents would lovingly and flexibly apply this routine, no? So that the children would also not be stressed na parang pag hindi ko to nagawa ng 4:30, baka magalit si mommy. Okay, so, but it's important, yes, it's true, to follow through, no? Face-to-face interaction by the parents.
Yes, so hindi rin dapat ma-stress ang mga bata. Baka sobrang tuloy-tuloy na lahat pag distance learning. We have another question from Maricar. My kid is giving me a hard time and won't study. What can I do to motivate her?
Okay, so I think it's applicable in general parenting, no? Just like I said earlier, you discuss, no? If you make a routine, make sure you involve your child, no? In making the routine. So alam mo na participative siya, may involvement siya sa paggawa ng routine, no? So alam ng anak mo na ito may playtime, merong study time, may online classes, no? And merong time to bond with the family. Okay, so if you clearly involve your child, no, to make the routine, at alam mo na payag siya kasi napag-usapan yun, and maybe better to write it down, no? The routine or the schedule. So ramdam ng anak mo na, ay, nag-participate ako dito sa pagpaplano ng routine, hindi lang si mommy ang nag-impose or si daddy ang nag-impose. So given this, you should have a well-balanced, no, structure na hindi na lang puro aral-aral or wala man lang play, no, or bonding. Or yung iba ang nangyayari, may online classes na nga, and then the time, their children's way to relax is also touch can use. So let's remember, parents should provide a good balance between the on-screen activities, lalo na ngayon na merong online classes, and don't forget to give off-screen activities that would be a good venue for social interaction with the family members. So I think that would help him motivate. Tapos you add
make your kids
rewards.
That's right. Make your kids feel part of the process also, part of the planning that will empower. Now, with distance learning looking to be the new normal, parents have to properly manage remote education with their children. What will it look like and how do we prepare for it? We'll talk about that after the break. We'll be right back on The Doctor Is In. Hi, I'm Dr. Freddie Gomez and welcome back to The Doctor Is In. While distance learning can be an opportunity for parents to have longer quality time with kids at home, it may be hard to manage for some, especially now that most of us are back to work. Still with us is psychologist Dr. Annalyn De Guzman Capulong. The task of supporting children, Dr. Capulong, the children's learning has now fallen mostly in the hands of the parents, and this could be quite a burden given that most of them are out at work. How can parents properly manage their time?
So I think I have to salute parents because parenting itself prior to COVID is really challenging. What more now that we have the pandemic, no? So I think it's best that parents should get support from each other, like spouses, no? So it's not only the burden or at least the task of child rearing, including yung pag-aaral, pagtulong sa pag-aaral ng mga bata, will not fall on just one parent, no? So I think the same if we give routine or schedule for the children, make sure that the parents, no, husband, wife, or other caregivers involved in the family should also divide the task, no, para it will not be very stressful for one parent alone. Okay, so it's very important to divide the task, to properly communicate with each other, so that when one is guiding the child, the other parent is able to relax, no? Because it's also important to remind parents to have self-care because they have to be well, they have to, in order for them to really guide their children properly. So let's not forget to empower parents, no? So it's informations like this and also communication, and then I think best nga yung support, no? Especially I think we're thankful that of our families are extended family and we can get support from the other family members.
Yes, I think it's very important as well na hindi ma-stress ang mga parents because they play a very big part on the future of their kids, lalo na ngayon na pandemya na. Now let's go to another very important subject that concerns a lot of parents out there. A full return to the normal that we know does not look like it will happen anytime soon. And this could have serious consequences on your people's social and emotional development. Doctor, what kind of support should parents provide their children? Is there a manual or a playbook to get this right?
Well, the pandemic, I think, ang malaking relasyon nito dahil nga ang bata ay nasa bahay, many parents would resort to using gadgets, no, for babysitting or to have extra time for themselves. So pag nag-gadgets yung anak ko, okay, makakapahinga ako. But then I had a recent study, no, involving touchscreen use and the effect on children's cognitive and social emotional development. No, it says the results show that it's very important na ang magulang ay magpataw ng regulation, no, in terms of touchscreen use. Kasi ang mangyayari, the results also show that the higher touchscreen use is actually associated with lower scores in cognitive and social-emotional development. But alam ko sa konteksto natin na may pandemya, hindi natin maaalis na mag-touchscreen use, especially kung may online classes. But I'm saying na consciously, I hope parents would really regulate their children's use, no? Monitor their children's use. Hindi pwede yung ika nga one to sawa na hanggang 3 hours, 4 hours they will really use, especially for leisure. So I think, reminder, very important that parents would be highly involved in monitoring their children. No, regulate the time that the children use and also regulate the content that they are using. No, so I think that basic action, no, could really help parents monitor, no, their children's use. Kasi ang laking bahagi ng touchscreen use during this pandemic, no, sa home life of the children and parents.
That's right, and here are some tips we have for concerned parents. Parents can provide regular opportunities for children to connect with other family members and friends through video or phone call. Although, kailangan malimit din ng touchscreen use. Katulad na sila also give their children goals to work towards during their time at home. And most importantly, parents can prioritize spending quality time with their children to increase their sense of security. So just like to reiterate what Doctora said, don't make these gadgets a substitute for your ability to parent your child. Mas magaling kayo dun sa mga gadgets na yun, Nandi Hamak. So keep those touchscreen time to a minimum. Ika nga. Okay, now it's time to answer some social media questions. Let's answer one from Lito. Ang tanong ni Lito, what kind of goals should I set for my child, especially now that virtual learning is quite new to both of us?
Okay, so I think malaki yung role ng eskwelahan, no, sa paglinaw kung ano ba yung mga goals. Kasi if we are talking about academic setting, online classes, iaayos yan ng eskwelahan, no? Kung ano ba yung mga particular goals, learning goals na dapat na ma-achieve, no, ng mga bata pag sila ay uma-attend ng online classes, no? So on the academic yon, pero on the part of the parents, no, so I think mahalaga na alam natin kung ano yung mga learning goals na pinataw ng mga eskwelahan para may follow through. Hindi lang online classes, kahit sa offline, no, during in the home environment, kayang madagdagan, no, o ma-facilitate ng magulang kung ano yung kailangang matutunan ng bata. And I think yung tanong na yun, depende rin kung ano yung ano yung edad ng bata. Kung school children, the school will help clarify these goals. Pero kung yung mga preschool, I think it's best that there's more parental involvement because young children really, the very young children, they learn best really face-to-face interaction through exploration and play. So let's not forget really and highlight the importance of parental involvement.
Okay, and here we have another very timely question from Hernani. What can I do if my daughter is always spending time on her phone? Ano po ang limit sa paggamit ng gadgets?
Okay, so I think this will be lovingly done if you discuss it with the child, with your child. Kailangan clearly maiparating mo sa anak mo na hindi pwedeng buong araw ay magpo-phone na lang kung ano man ang ginagawa niya sa smartphone, So kailangan there's a time for everything. Hindi pwedeng, 'di ba, buong araw hawak ang gadget or ang cellphone. So it's very important to set limits, And this will be better kung talagang clearly you convey to your child ano ba yung rules and regulation natin in terms of gadget use. Gaya nga ng sabi ko, talagang madali na pabayaan na lang yung mga anak na gumamit ng gadget. But then, let's try to provide a balanced set of activities. So kailangan malinaw. At pag hindi sumunod, meron din siyempre consequences. You can lovingly practice discipline without physical punishment. You can curtail or remove privileges pag hindi sumunod. So pag hindi ka sumunod, hindi ka makakapag-gadget bukas. So gano'n, may repercussion kung hindi susunod. So mahalaga na magpataw ng rules and regulation. At hindi kailangan komplikado ang rules and regulation. Simple lang, limit content would help.
Okay. Maraming po salamat, Dr. Annalyn De Guzman Capulong, and to our viewers for joining us today. This pandemic has disrupted the way we do a lot of things, and that includes learning for millions of young people in the country. And while distance learning can be as effective as traditional classroom learning, it has its own set of challenges. Kaya dapat hindi lang ang mga bata ang handa, kundi pati na ang mga magulang. We hope that we were able to answer some of your lingering questions about our topic today. We'll see you again tomorrow at 3:30 p.m. here on The Doctor Is In. I'm Dr. Freddie Gomez. Stay safe, everyone.